Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha from Roots Community Health Center reporting for the week of September 27th, 2021. As health professionals rooted in Oakland serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise to give you information you can use to keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Alameda County now has a total of 113,966 COVID-19 cases. That's up 574 cases from last week when I reported, and deaths are the same at 1,328. COVID vaccines continue to creep up, and we are now at 90.6 of those 12 and up with at least one dose, and 77.7% of those 12 and up being fully vaccinated. And Oakland is just behind at 89 and 75% respectively. In terms of daily cases, you can see that those are coming down. The lower graph shows the 14-day cases, and you can see that is certainly coming down as well. So we are very grateful for that. And we also know that just as sure as those cases came back down, we can expect them to go back up at some point. This is the nature of COVID-19 and appears to be where we are right now in terms of our vulnerability based on vaccination rates, which just are not high enough here in the United States and around the world. And we know that that is really what it's going to take for us to see our way out of this pandemic is vaccination. That is our way out, appears to be the only way out. So now is really the time to make a push to get more people vaccinated, and so that we can protect ourselves now. So while cases is low is not the time to start relaxing, it's actually the time to double down and really make a push to increase vaccination rates across our communities, and so that the COVID-19 cannot spread so quickly, so that it won't have to peak as high as it did last year. In our wintertime surge, we really want to avoid anything of that magnitude. We're certainly hopeful that that won't be the case, but it's very hard to tell because we certainly didn't expect our summertime surge that we're coming down off of now to peak as high as it did. And so we really don't want to take anything for granted here. We also want to reduce the chances of mutations. If we can stop the spread, then we stop the mutations and we stop impacting the effectiveness of our vaccines because of mutations. And of course, by increasing vaccination rates, we also do a much better job at protecting who is still vulnerable, which is our unvaccinated folks, including everyone under 12 years old, also those who are immunocompromised or who may not have mounted a good response to the vaccine in the first place. And so by increasing vaccination rates, we can keep the case rates down, hopefully not have to experience a huge surge again, and also protect the vulnerable among us. And so unfortunately, even though Alameda County does have on average great overall vaccination rates, we still have some spots that are quite a bit lower than the county average. We've still, in fact, got 3 zip codes in the county that are under 70% fully vaccinated. The lowest being in East Oakland in the 94605 zip code, and then the 94578 in the Hayward and unincorporated area, and then 94612, which is in West Oakland. And then by contrast, you've got the 94707, which is in Berkeley, at a 95% fully vaccinated rate. So we really want to see what we can do to get our entire county up to those impressive rates, and so that we can have more even coverage, particularly for our most vulnerable populations. So one of the questions that I know that we've all been wondering about is just how effective are our vaccines in the time of Delta, because we know that they were impressively effective in the 95-96 range with the wild type SARS-CoV-2 that we were first battling, and with those large trials for the vaccination, those were the kinds of results we're getting. And we know that it's taken a little bit of a hit with Delta, but I think that the good news has been that it is still protecting against hospitalization and death. But we really wanted to take a look at some of the evidence, and so In this recent report from the Morbidity and Mortality Weekly Report, we have a comparison actually of the effectiveness of the 3 different vaccines that are available here in the United States. They looked at 3,689 hospitalized adults over 18 and over. This was across 21 hospitals in the U.S. In 18 different states. And they specifically looked at the time period of March through August 2021. And so this really is in the time of Delta. They also did a secondary analysis of 100 vaccinated healthy volunteers, and they looked across 3 hospitals, and they looked at 2 to 6 weeks post-vaccination, and they drew different types of antibodies to check the antibody levels. And they did this again with the 3 different vaccines. And the bottom line of this analysis is that it did show that the Moderna vaccine was really holding up very strong at 93% vaccine effectiveness, the Pfizer at 88%, and the Janssen J&J at 71%, protecting against hospitalizations. And just a couple things to note here. They took out everyone with immunocompromised, so this did not include people with immunocompromising conditions. This was really looking at those with a presumably intact immune system, and it was comparing these 3 vaccines. And so I think that the implication here is that there are some variations in how protective each vaccine is, but really that all 3 are still providing excellent protection against COVID-19 hospitalizations. And kind of in order, it appears to be Moderna, Pfizer, and then the Johnson & Johnson vaccine. I also wanted to share this report, also in the Morbidity and Mortality Weekly Report, that was showing estimates of how effective the vaccines are against emergency department or urgent care clinic encounters and hospitalizations, and also during a time of Delta. So this one was even more in the time of Delta. So this looked at June through August, and this one was a huge study looking at 32,867 medical encounters. And really it looked at sort of a combined effectiveness of the vaccine. So it looked at all 3 of the COVID-19 vaccines combined and showed that they were all taken together 86% effective against hospitalization and 82% effective against emergency department and urgent care visits. And so these estimates overall looked similar to the months before Delta became the most predominant strain, with one exception, which was the group of those 75 and up. And they did show a small decline in effectiveness for this group. And so this is an important study because it was so large, and it is still again showing that for most groups that the effectiveness is holding up for all 3 vaccines, and really having vaccine effectiveness of 86% against hospitalization is still quite excellent as vaccines go. So in booster news, there's been a lot that's gone on since I reported last, and I think I will just kind of cut to what the current recommendation is, and that is that those 65 and up who have received Pfizer, as well as all of those who are residents of long-term care facilities, should get a booster vaccine. And so this is really a vulnerable population. Unfortunately, this recommendation is specific only to the Pfizer-BioNTech vaccine. And again, 65 and up, as well as residents of any age in long-term care settings. The next group is those 50 to 64 with underlying medical conditions. Also are eligible for a booster shot of Pfizer-BioNTech. And for both of these groups, it's at least 6 months after completing the primary series. So it doesn't have to be immediately at 6 months, but at least 6 months, a minimum of 6 months. And again, this is really 50 to 64-year-olds with an underlying medical condition, as well as those 65 up, and everyone residing in long-term care settings. And the underlying medical conditions for the 50 to 64-year-olds is left a little nebulous, and there really isn't any proof that's going to be required, or really a whole lot of specificity actually. And so if you're 50 to 64, you have an underlying medical condition, you may receive a booster if it has been at least 6 months since your Pfizer. But it's also something that you can speak with your physician about to see if they would recommend that that is what you do. And so we know that the part of the recommendation that was a little more hotly debated in the Advisory Committee for Immunization Practices meeting, but that was actually voted down and then ultimately restored by the CDC director, Dr. Walensky, is that those who are 18 and up and at risk, either because of an underlying diagnosis or because of their occupation, and again, both of these are quite vague and they're not very well defined, also are eligible to receive a COVID-19 booster shot 6 months after their primary series with Pfizer, and the booster is of Pfizer, and this whole conversation is only about Pfizer at this point. And so we know that President Biden sort of got out ahead of all of this, saying that he wanted everyone 18 and up to be getting boosters, and he didn't waste any time himself getting his booster shot, as you can see here. But in essence, although these recommendations do make some differences between the different groups, at this point, those who are 18 and up may be eligible for a booster. And I would say that if you are 65 and up or a long-term care facility resident, then there really is not any reason to delay in getting your Pfizer booster if you received Pfizer as your primary series. 50 to 64, I would also probably have a fairly low threshold for that, because we know that in certain groups, certain race and ethnicity, that there is a higher risk of underlying conditions. We know average life expectancy can even be shorter. So from a perspective of equity and wanting to make sure that all the most vulnerable groups do get this at the appropriate time and the appropriate age, I would say that 50 and above with underlying conditions, that a booster after 6 months from the primary series is perfectly reasonable. Again, when in doubt, please speak with your physician. When it comes to the 18 and up, I think this is where things get a lot more individualized, and this becomes a bit of a difficult question about how important this is, how necessary this is, and how much do the risks outweigh the benefits. I'll speak very briefly on risk, which is that really these vaccines remain safe. However, there's not a whole lot of data about the boosters in the younger age groups, and particularly the age groups where we have seen the higher incidence of myocarditis with the primary series. And we don't know yet, because they haven't been giving the boosters to this age group. We don't know whether this will be a higher incidence with the boosters or not. And we know that the risk of myocarditis is higher in the under 30 age group. And so although we know that for those who get COVID, their risk of myocarditis is much higher than it is from getting the vaccine, we here are talking about a booster dose. And so really weighing out whether there is benefit to doing that booster dose for particularly young men under 30 years of age, compared to sort of an unknown risk for the booster dose, is still a little bit of an open question. And certainly this will have a lot to do with what those underlying diagnoses are and what the risk of exposure is based on that person's occupation. And so I would say that for those under 30 who are contemplating this, I would recommend a discussion with the primary care physician, and probably for all of those under 50 without underlying conditions, really it is going to be more of a risk-benefit analysis around how long it's been, since you got your primary series, as well as how at risk are you. And then also, and this was not taken into account really in the recommendations, but I think it's something for each of us to think about. Also, who are we going around who is at high risk? And so all of these things would factor into, I think, the equation around getting a booster or not. And so it's important to say that what the committee took up was really following up on the Pfizer only request for approval of a booster. And so it's leaving those who've received Moderna and J&J a little in the dark about what to do next. And so I will just say that we are waiting for the Moderna to receive its full approval. They submitted at the end of August for their full biologics license, and hopefully that will be approved soon. And at that point, it does open the door a little bit more for some recommendations around the booster and for an application for the booster. J&J has yet to submit, and so we really don't know when that's coming. And the other sort of blind spot we have is that we don't have results of studies for mixing and matching. And those are studies that are underway that we hope to hear about soon. So what to do if you had Moderna or you had J&J? How do you sort of decide which way to go? And so I think, again, this goes back to what is your risk of exposure and what is your risk of getting COVID-19 if you're already fully vaccinated. And this will depend on how long it's been since you got the primary series, which vaccine you got, but also what kind of exposure that you're exposing yourself to. And we really want everyone to continue to be cautious, but we know that some occupations are going to be higher exposure than others. And then who are you going around? So who are you risking transmitting it to? So these are all part of your risk kind of calculation. And I would say that with the Moderna, it will be great if we just have more data to understand, because you could go out and just get yourself a Pfizer booster. We know that now that these floodgates are opened, that these criteria are loosened up, that it's going to make it easy for people to get it. But is it the best thing? And so I think these are all discussions for your physician. But for example, Moderna could come back and say, well, we think a booster is needed, but not until 8 months or 9 months. So we really don't know what the optimal recommendation is going to be. And one thing to understand is that there is some indication that the longer intervals that some countries did between doses has actually helped to give additional protection. We don't have all the definitive information on that yet, but this is why more data could be helpful to really crafting the best recommendation. So again, right now, the recommendation is just for the Pfizer-BioNTech 6 months after the primary series for those groups that I mentioned. And for Moderna, if we're able to sit tight, if we're not in an extremely high-risk group and getting a lot of high-risk exposure, if we're able to sit tight and wait for those definitive recommendations and have the data, that is the most ideal. If you're in the Johnson & Johnson group and let's say you're over 65, and let's say you do have underlying conditions, this is definitely a conversation that I would be having with my physician, because although there is not data, again, if you're in a high-risk category and at high risk of exposure, and we sort of don't know when we're going to be getting data back about this, because in terms of at least the regulatory part from the FDA, even the full application hasn't been submitted. Now remember, Johnson & Johnson hit the market several months after the mRNA vaccines, so there's nothing unusual about this timeline. But what we are grappling with is the impact of Delta, the decreased vaccine effectiveness because of the combination of the time that's gone by and the Delta variant. And it's leaving us questioning and wondering what is the right thing to do. And I think this is going to likely be in the category of an individualized decision to be made along with your physician if you are in the either the Moderna but particularly the Johnson & Johnson, based on the things I mentioned, the somewhat lower vaccine effectiveness, along with not knowing what the timeline might be for that. Now, having said all of that, the NIH is doing studies on mixing and matching. We do expect to have some data and information, irrespective of this whole kind of regulatory part. We should be getting more and more data as the days go by on what might be recommended there. So that is another potential argument for waiting, that it is potentially, it's a possibility that with Johnson & Johnson, there will be a specific recommendation about which vaccine to take and at what point. And so again, I think if we're all able to exercise caution and protect ourselves, we know that if we've gotten a primary series, we have protection that is excellent, and that for places in the country whose hospitals are filling up, the people in the ICUs, the people in those hospital beds are overwhelmingly unvaccinated people. So at this point, as we're talking about booster doses, we're really not talking about the meat of the matter, and I hope that we're not getting distracted by this booster conversation. I think a booster is going to help those people who need to optimize their response, but really the bottom line is what we're worried about is the remaining unvaccinated. What we are still waiting for is Moderna full approval for 18 and up. Again, that was submitted about a month ago. Hopefully any day now we'll get the full approval. J&J application for a full license for 18 and up. We're also waiting for the applications for 5 to 11-year-olds, and Pfizer has indicated that it will be any day now. And then later we will anticipate a 6 months to 4-year application. And we are anxiously awaiting that heterologous vaccine data or the mix and match vaccine data, and we hope that that will be forthcoming soon as well. But all of that being said, our focus really needs to be on a couple of things. Number one, the remaining unvaccinated here in the United States, but all over the world. There are parts of the world that haven't seen the vaccine yet, or entire countries where the vaccination rate is 1% or 2%. And that level of disparity in vaccination at this point in the pandemic really is our biggest barrier to getting this pandemic under control. In this country, same. We have areas with very low vaccination rates, and those are the areas where the unthinkable is happening. People who have nothing to do with COVID, but who need a hospital bed, who need an ICU bed, are unfortunately not being able to access care. And that is a public health issue, and it is absolutely devastating and really quite unacceptable at this juncture. And so our focus really needs to be on fixing that situation, getting the remaining unvaccinated to be vaccinated both here and worldwide. And then second is all the other layers of protection. So one of the biggest challenges that we've had here is that we seem to be having trouble doing multiple things at once. And we're going to have to get better at this because we are in this for a while. We know that the vaccines are not 100%. The vaccines are the best protection we can possibly get, but they're not going to do it alone when we have the level of transmission that we have around the parts of the state, parts of the country, and many parts of the world. We're still in an evolving crisis, so it's not enough to just say I got my vaccine and I'm just going to go do whatever I want. We really need to be thinking about all of the layers of protection, and we have to be thinking about it in terms of the different ways that COVID-19 spreads. And so we have aerosol spread, and that is the main type of spread we are worried about in an indoor setting. And so to avoid it, of course, we should be outdoors. We should be distanced. But if we must be in an indoor setting, then we are going to want to avoid crowded indoor spaces. We're going to want to wear the highest filtration mask that we can tolerate. And we are going to need excellent ventilation. And distancing helps. But really, when we are indoors, what we're thinking about is a shorter duration of time with better ventilation. Droplet transmission is the next type of transmission, and for this, the mask takes care of the most of it. Also, a shield or barrier, those could be those plexiglass shields, or also even your own eyewear, will also be a barrier for droplet transmission. So once again, if you are standing outside, that's great. You should not have any aerosol transmission. But if you're standing 2 feet from someone and talking and spraying on one another, you can transmit COVID-19. So distancing and masking and a shield when you're with people outside of your bubble and you are within 6 feet, even if you're outside, is still prudent to be protecting yourself against droplet transmission. And last but not least, well, last and least really, is the contact or surface transmission. And we can take care of most of this by hand washing and not touching your face. Wearing a mask helps you not touch your face. And so wearing a mask is important for all three of the modes of transmission. And sanitizing and disinfection is still important, particularly of our high touch surfaces. Remember that if you have symptoms, you should get tested right away whether or not you are vaccinated. And if you believe you are exposed, you should isolate yourself, get tested in 3 to 5 days, and continue to isolate until you get your results. If you do test positive, please do what you can to get your close contacts to get tested and isolate as well. If you are positive and in a high-risk category, please inquire about monoclonal antibody treatment. It can save lives. And for everyone, to optimize your immune functioning, take a multivitamin supplement, consider additional vitamin D supplementation, manage your stress, and get a good night's sleep. This concludes today's People's Health Briefing. For any questions, please email at admin@rootsclinic.org. Thank you for joining us. Please tune in next Tuesday at 10 a.m. See you then.